No?
A hearty good afternoon and welcome to our session on prevention and screening of gynecological cancers. We are glad to have Dr. Vimla, Senior Consultant Obstetrics and Gynecologist from Apollo Cradle and Children's Hospital from Marathalli, among us today to help us understand the topic. The doctor will take us through that and more in this session today. Doctor, you have the stage.
Yeah, thank you for the introduction. Hi, everyone. Good afternoon. Myself, Dr. Vimla from Apollo Cradle, Brookfield, Bangalore. Today, I'm going to talk about prevention and screening of gynecological cancers in women. So, what are cancers? Cancers means abnormal growth of the cells in the body. If they occur in the women's reproductive organs, we call it as gynecological cancers. Different types of gynecological cancers are uterine or endometrial cancer, cervical cancer, ovarian cancer, vulval, and vaginal cancer. So, the most common important cancer is cervical cancer. What are the risk factors and why is the screening and the prevention important for the cancers? Because early detection, there'll be early intervention. So, early intervention means it can be detected even if before the women has the cancer in the body by means of precancerous stages. When it is detected, the early treatment will be given. Coming to risk factors. For any cancer, there are two types of risk factors. One is modifiable, where we can modify, and if required, we can remove all that factors so that we can prevent the cancers. And there are other factors like non-modifiable, which can include the age, the gender, that means the female has all the gynecological cancers, ethnicity, and the race. Modifiable can be again primary and secondary. Primary will include everything like alcohol, smoking, unhealthy lifestyle, stress factors, or obesity. All these things come under primary modifiable risk factors, where we can avoid by reducing the obesity in men. Like we can ask them to have only 2500 calories, in women 2000 calories, to reduce the obesity and prevent the alcohol and the smoking and reduce the stress by means of physical activities. The secondary modifiable risk factors would be like infectious agents or ionizing radiations, UV radiations. All this come under secondary modifiable, where by removing them out, we can prevent the risk of cancers. Like I told you all early, the most important cancer is the cervical cancer, next in ranking to the breast cancer. Almost 17 to 18% of the women suffer with this cervical cancers. What is the cause of the cervical cancer? It is caused by human papilloma virus, a virus which has lot of strains in it. It has a strain which is of low risk and other strains which are of high risk. Low risk strains causes only warts in the vaginal area, and the high risk strains can cause precancerous and cancerous stages. And for this, the women may not show many symptoms. She might have abnormal vaginal discharges or abnormal bleeding or pain during the intercourse, but these and all are at a later stage. So even before the symptoms are seen, we can diagnose or screening it by means of the screening tests which are available for the cervical cancer. The screening test would be like pap smear test, cytology, or going for VIA, which is visual inspection of acetic acid. Before talking about the pap smear, what are the risk factors for the cervical cancer? Risk factors would be if she is having multiple sexual partners, or if she is having sex at an early stage, or first childbirth is at a later stage, or using infertility medicines, obesity, alcohol, smoking. All these are causes of the cervical cancer. So coming to pap smear, who should get the pap smear done? Every woman, when they are sexually active or after the age of 21 years, they are fit to get the pap smear testing done. From 21 to 29 years, we do it every 3 years once, and from 30 to 65 years, every 3 to 5 years once. More than 65 years, we can stop the screening if she was having three previous pap smears as normal. And those who are hysterectomized, we can stop the screening procedure. But if we are doing HPV DNA testing, we can do it every 5 years once. So, what are the prerequisites of doing the pap smear testing? We usually do it after the menstrual cycle, not during the periods time, to avoid unnecessary reports being inaccurate. And these tests, if they are having any cervicitis or vaginitis, like infections of the cervix and vagina, those have to be treated prior and then go ahead with the testing. Any vaginal douching, creams usage, all those have to be avoided. And we have to ask the women not to have intercourse at least 24 hours prior to the testing. This test is a simple test which we do it in a OPD procedure. It is very minimal pain or painless. It is done by making the women lie down comfortably in her lithotomy position and putting a simple speculum inside, catching hold of the cervix and taking a smear with the brush or the spatula from the ecto and the endocervix. This, when we test it and send it for the HPE testing, we get to know the result. And with this result, if this result is showing some precancerous stages, see, pap smear is not only for testing of the precancerous stages or the cancerous stages of the cervix, but any infections of the cervix also we get to know. If it is only the infections, we give them antibiotics or antifungals accordingly. And if it is a precancerous stages, then for better confirmation, we do colposcopy. In that also, if it is confirmed, if it is showing positive, then we offer them different treatments like diathermy, which is putting heat, or cryotherapy, where we put ice pack and then boil, then we damage the cells. Or you can have lot of other treatments as well. Hysterectomy is not the only treatment for those who have got positive. But if the woman is not able to come up for the follow ups, and if she wishes to get a hysterectomy done, then hysterectomy would be the option. Coming to next modes of screening methods for the cervical cancer, which include visual inspection with acetic acid. We'll apply the acetic acid and look for the abnormal cells. And there is one prevention by means of vaccine. Vaccine, there are different types of vaccines: Cervarix, Gardasil, Gardasil 9. Your doctor will decide according to your age, and she will let you know. Usually, the vaccines are best to be given before 26 years of age, even before the sexual activity, and their pap smear should be shown negative if they are going ahead with the vaccines. And by giving the vaccine, it doesn't mean that the pap smear testing has to be stopped. That has to be continued as discussed earlier, like 3 years once or 5 years once, according to the age. And these vaccines, if they are less than 16 years, we give two doses 6 months apart, zero dose and 6 months. And if they are more than 16 years to 25 years or 45 years, if their pap smear is showing negative, the vaccine will be given in three doses, 016 or 026 accordingly. Now, coming to the next cancer, which is called the ovarian cancer. This is uh, called as silent killer, where it usually is asymptomatic, do not have any symptoms. Only when the women enters into the second, third, fourth stages, only she starts showing the symptoms. By the time it might be too late, so there is high mortality rate because it is symptomless, and it is not having proper screening methods as well. And this ovarian cancer, what are the risk factors? Early menarche, that means early they get their maturity, and then late menopause, or nulliparity, not having kids, or obesity, or unopposed estrogen usage. All these are the causes for the ovarian cancer. By the time they reach the symptomatic stage of having abdomen bloating, changes in the bowel, changes in the bladder habits, or having ascites or mass in the abdomen, it would be too late for us to diagnose. The screening methods are not proper for cancers other than cervical cancer, and for ovarian, endometrial, or the vulval and vaginal cancers, usually the screening methods are not too much. By yearly health checkups with the gynec, you might be able to prevent these kinds of cancers. And coming to screening methods, which can be helpful for those with high risk, the family history is there, or they are high risk for this ovarian cancer. Every 6 months, once one ultrasound, and doing BRCA testing, BRCA1 and BRCA genes testing, and doing biochemical marker testing like CA125 is the first and foremost marker which we test, which should be less than 35. And if it is more than 35, usually we'll have to rule out the other causes where the CA125 can increase. And if it is no other cause is included in that, then we have to keep a close follow up. And then doing an ultrasound. In ultrasound, if we find that there is an cyst or a mass in either of the ovaries, which is usually both the sides, bilateral, and if it has septations inside, solid, then it gives us a suspicion for cancer. In those women, we can do the biochemical markers other than CA125, depending on what we are suspecting. We can go for CA99 or CEA, carcinoembryogenic antigen, or alpha fetoprotein, or HCG, so on. Those markers depends on which cancer we are suspecting. The others can be the recent advances. It is shown that liquid biopsy. This is the test which has shown in the recent thing, and this helps in detecting the ovarian cancer. And through all these methods and doing them yearly once, we can help prevent the ovarian cancer. And in those with high chances of ovarian cancer or with family history, we can suggest them ovarian salpingo oophorectomy. That means we can ask them for a removal of the ovary along with the tube if they have completed their family, so that it would help them from preventing the mortality, which is death. Coming to the other cancer, which is the endometrial cancer. Endometrial is nothing but the uterine cancer. The risk factors would be the same, like having early menarche, late menopause, first childbirth at a very late age, or using high doses of estrogen, nulliparity, all this will come. And endometrial cancer, usually they can present with abnormal uterine bleeding or postmenopausal bleeding. Usually these kinds of cancers will be seen at a higher age group, who have reached their menopause or postmenopausal, and they can come and present with postmenopausal bleeding. But it doesn't mean that everyone who is having postmenopausal bleeding are having cancer. It can be because of other causes also, like it can be a polyp or endometrial normal thickening of the endometrium, or any other trauma, it can be, or other causes of the vagina and vulva also it can be. So not necessarily always a cancer. And in this endometrial, if we are suspecting endometrial cancers or women who have come with postmenopausal bleeding, we would suggest them to go for an ultrasound to see the endometrial thickness. Endometrial thickness, the cutoff in the postmenopausal women usually is less than 4 mm. And if it is more than 4 mm and they come to us with a spotting, better we do an endometrial biopsy for them. This can be done either as an office procedure, like we can do it by means of People's biopsy in the OPD only, which is less expensive, and we can collect even 95% of the cells. But the only disadvantage here is we will not be able to see clearly the interior of the uterus and then collect the cells. The other procedure is called hysteroscopic guided biopsy, where we'll be able to introduce a hysteroscope through the cervix into the uterus and clearly visualize the complete interior of the endometrium, and then take the cells for biopsy and send it to the HPE testing. Coming to vulval and vaginal cancers. These cancers are very, very rare, and these are especially seen in elderly women who are more than 70, 80 years. They are either present with severe itching over the vulval area with vaginal foul smelling discharge or lesions. If they are having any of the symptoms, we have to take a biopsy and rule out to look for whether it is normal or an abnormal lesion. Before I would conclude, I want to add a note about the breast cancer as well, because breast cancer is one of the most important cancer, and it has the highest rate in India, which is almost affecting 25% of the women. Breast cancer prevention or the screening is mainly by means of self breast examination, then going for breast examination by the doctor, ultrasonography, and then comes the mammography. Self breast examination should be done by every woman after she completes her periods every month, with the palm of the hand, keeping it in the rotating motion. We have to examine the breast. The breast has to be divided into five quadrants: upper two quadrants, lower two quadrants, and the middle quadrant, which includes the areola and the nipple area. By rotating motion, you have to palpate your breast to look for any mass or cyst or anything if you're feeling abnormal. Finally, you have to check all the quadrants and then come to the fifth quadrant and then press the nipple area to see for any discharge from the nipple, which can be either blood or pus or any serous discharge. This has to be done for both the breasts, and for the left breast you have to palpate with the right hand, and with the for the right breast with the left hand. This has to be done routinely every month after your cycle is over, and yearly once check up with the doctor to see if you have not missed on anything. Ultrasonography of the breast doing every year once is a good practice. And for those with high risk, means if they're having any family history of breast or ovarian cancer, better go for yearly once checkup with the doctor for the breast examinations, as well as do an ultrasound if they are less than 40 years of age. But if they are more than 40 years of age, directly you can go for X-ray of the breast. Now, to conclude, gynecological cancers, most of the cancers they have, cervical cancer has pap smear testing, which can be done every 3 years once, and it can be detected at an early stage so that you can prevent the women from going into the cancer stage. And there are other screening tests for ovarian cancers, like looking for the ultrasound or the biochemical markers, or uterine by doing an endometrial biopsies, or vulval by doing biopsies. So by means of these screening methods, the early detection, the early intervention, and the early treatment would help you to be staying healthy and fit for more life, and preventing the morbidity and mortality. Yearly once checkups with the doctor will help you go through all the screening and preventive measures. And to add on, I would say that if there are any modifiable risk factors like alcohol, smoking, less physical activity, and any stress, or if you are having uh, uh, obesity, try to reduce all those and remove the alcohol and smoking, so that you will be preventing from getting these gynecological cancers. Thank you, one and all. If there are any questions, I would be answering them, or you can just post it in the chat. I'll be getting them at a later stay, so that I can answer them and send it to you all. So I think there are no questions in the chat group. Thank you, one and all, for your patient listening.